Greetings. Let us learn about pancreas anatomy, what the radiologists look at, and what we should also be looking at. And I would like to thank my support, Dr. Stroline, Dr. Butt, Miss Angela Deal, my institution, and my mentors. I would like you to read this notice. So whenever you see a patient with abdominal pain and you think there is a pancreas problem, we end up doing a CT scan with IV contrast with a special protocol called Pancreas protocol. And we look at images like this. And when I'm on service with my trainees struggle looking at these images and making sense out of that. To help them, I'm creating this tutorial to go step by step. To learn this, you should go back and look at the basic anatomy, and then you'll appreciate this anatomy much better. So for this, what I've done is to appreciate the grayscale image here on CT with IV contrast. Contrast fills up the vessels. I've also used color images, and then upon the color image, I superimposed the grayscale image of CT for your easy understanding. So let us start this. Two principles I want to share. One, when you're looking at this section, you should appreciate that you are looking at the patient's body from the foot end of the bed. When you're at the foot end of the bed, you know that the patient's liver, that is on patient's right side, is towards your left side of the image. So you should keep that thing in mind. Number two, in imaging, you identify the structure, especially cross-sectional imaging, you identify the structure by tracing the structure up and down. So you scroll up and scroll down and trace, and then figure out what that structure is. So if you learn those two principles, you'll be in fairly good position to do a lot of learning. And if you are not sure, start from the spine and then identify the structures in front of the spine one by one. So let us start this section. How do I teach my fellows? So we start with the spine. Here is the spine. Easy to identify the spine. And on CT, you can easily find out the spine. In front of the spine, you have two major vessels in the abdomen, at least in the upper abdomen and mid-abdomen, aorta and inferior vena cava. Aorta is round, and you can see that. And then on CT, you see this round structure, the aorta, right in front of the spine. Big vessel. And to the right of the aorta, you see the inferior vena cava. Veins are collapsible, so they're not round. They have oblong shape or could be ribbon shape if patient is completely dehydrated. And on CT, you'll see the IVC. So you've identified the spine, you've identified the aorta, you've identified the inferior vena cava. So once you identify the aorta, think about this as you're scrolling through the images from the chest down. As you go down, you know that there are two major vessels in the upper abdomen that come from the front of the aorta, not to the side, front of the aorta, celiac trunk and superior mesenteric artery. Superior mesenteric artery juts in front, and celiac trunk and superior mesenteric artery, if you identify in between those two vessels, you will be able to find the pancreas anterior to those vessels. So here is the superior mesenteric artery in front of the aorta. And as you move up and down the CT scan sections, you'll see this artery going from the aorta anteriorly and then goes down. Okay. So this is what it looks like on CT scan, superior mesenteric artery. So once you identify superior mesenteric artery, you should also identify the splenic vein, superior mesenteric vein, portal vein confluence. The splenic vein crosses from left to right along the top portion of the pancreas. So here is the splenic vein that is crossing from left to right along the top portion of the pancreas. As it goes towards the right, it will join the superior mesenteric vein. So before we go there, let us look at the splenic vein on CT and then come back. And then as the splenic vein goes to the right side, joins the superior mesenteric vein to form the portal vein. That's the splenic vein, superior mesenteric vein, portal vein confluence looks like a bulbous end of the splenic vein. And this is what it looks like on CT. So once you identify the superior mesenteric artery, splenic vein confluence, you know that you'll be able to identify the pancreas very well, just in front of those structures. So here is the pancreas, right in front of those vessels. And on CT, you'll see those lobulations of the pancreas and a clean outline of the lobulations. Very important to keep in mind whether you can see the lobulations or not. So as you see the tail, you see the body, and you see the neck that is in front of the portal vein confluence, and then you see the head. When you come to the head, you should identify if there is a bile duct coming down. And here is the common bile duct. And this is what it looks like on section CT. Small round dot if it is not dilated. And then medial to the head of the pancreas and uncinate process, you will be able to see the duodenum, the C loop of the duodenum. You can move your CT scan sections up and down, and you'll be able to see the C loop of the duodenum. So that's what it looks like. So we have identified the pancreas, we identified the C loop of the duodenum. Now let us move to the right and identify the liver. And I'm just going to go through the basics of liver. I'm not going to go through the segmental anatomy of the liver, which is worth learning. And you can identify the liver, and then the pear-shaped structure, the gallbladder, very easy to identify, the gallbladder on CT. And then the veins inside the liver, the portal vein branches. Here is a portal vein branch. Okay, all right. As you come in front of the pancreas, you may see the stomach. Here is the stomach. And then to the left of the patient's body, you may see the spleen close to the tail of the pancreas. And here is the spleen. All right. And as you move up and down and you come to the right and left into the lumbar area, you may be able to see the ascending and descending colon along the paracolic gutters. That's what the colon looks like. if there is a lot of stool, you may be able to see the stool. Okay. And then we all know how to identify the kidneys that are on either side of the spine. Easy to identify the kidneys. Okay. So we have looked at systematically spine, aorta, inferior vena cava, celiac artery, superior mesenteric artery, splenic vein, superior mesenteric vein, portal vein confluence, pancreas, CBD, C-loop duodenum, liver, gallbladder, portal vein branches, stomach, spleen, colon. All right. So if you are thinking about, if you are looking at a patient with pancreatitis, you should identify the structures, the spaces. We know that the pancreas is a retroperitoneal organ, and I want to show you the different compartments. That's the peritoneal compartment or the peritoneal space. And the pancreas layer is in the anterior pararenal space. And then you have another space that is perinephric space. All of them are separated by different uh, walls or structures. Why is the pararenal space important? Because if there's inflammation, the fluid goes along the pararenal space on either side of the colon, along the paracolic gutters. And so that is something important to keep in mind. Okay. Whenever you're looking at a CT scan and you're focusing on different organs, take advantage of what else that the CT scan can offer, and it can actually give you a fairly good idea whether the patient is sarcopenic or not in terms of the protein mass, whether they are protein energy deficient or not. And the way to look at is look at the muscle. And people look at iliopsoas muscles, whether they're atrophied or not, to give an idea whether the patient is protein energy deficient or not. So something to keep in mind whenever you're looking at CT, take advantage and try to learn as much as possible about that patient. I hope this is helpful. Thank you. Take care. Bye-bye.